1. I'm Joel Edwards, CEO of True Recovery. I'm here today with Dr. Alva, founder and Chief Medical Director of Pacific Neuropsychiatric Services here in Orange County. And we're here today, Dr. Alva, to talk about really how things affected us in this pandemic year and what things look like for employers in their work environment, inviting their employees back to the workforce. So if we can, I'd like to kind of touch base a little bit of just kind of what you've seen in your practice in regards to people that are still employed and those that are kind of struggling with mental health or substance abuse, and what that looks like with this kind of not being able to go to the office at this point in time.
Well, thank you, Joel. I think that it's important to recognize that this pandemic has not only affected people from a physical perspective, it also has caused severe mental health damage. And what we are seeing nowadays is that businesses are being affected not only because folks are getting sick, physically sick, but because they suffer from a number of psychiatric conditions. The main one that we're seeing is, of course, anxiety. And anxiety can be defined into multiple things, going from a simple phobia, meaning I'm afraid of going out because the virus is going to get me, all the way out to frank and overt clinical manifestations of a panic episode. Now, panic attacks are the worst type of anxiety states, and that is the number one reason why people go to the emergency room, because the physical and clinical manifestations are significant and severe. They can range from dry mouth, blurry vision, sweaty palms, palpitations, and a feeling of impending doom. So we as employers need to take care of the mental health issues of our employees. I get asked this all the time. What do I do? How do I make my folks feel more comfortable and healthier? We have to create in our employees a feeling of safety. And the way that we do that is by normalizing the situation. Granted, COVID-19 is a horrible virus, but we have to approach it with a sense of hope and certainty. We cannot be ruled by fear. So we take normal precautions. You stay away from people. You wear a mask in appropriate situations and places. You wash your hands. Use common sense measures. Now, people don't like to stay at home, interestingly enough. Reason being, well, I have to take care of my child, my spouse, the dog, the pet, the cat, the canary, and they feel overly stressed because not only do they bring their work home, they now have to take care of everybody else in the family. So if we can, if it's at all possible, we should allow our employees to return back to the office with, again, the necessary precautions. You keep distancing, you create shielded situations, and again, you make sure that you have Purell at hand, you make sure that everybody is aware. And the second thing that we can do is create an environment where the patients, that is, the employees, can be tested. If anybody has any type of exposure, it is important for them to have a test, and that brings them peace of mind. The most important thing here, Joel, is not to be afraid.
Sure. Thank you for sharing that. And for us as an employer that, we treat patients like you do that are struggling with substance abuse and mental health on the one end. Then on the other side, we have our employees that provide those direct services to those patients and providing them the same opportunities of safety that you've talked about. And it's interesting to me, this is something you can touch on, is at the beginning of this pandemic, there was a lot of unknown and mixed messaging and no real direction to go. So us as providers or employers were left to kind of figure it out as we go. And over time, we learned a lot more about this disease. So we've learned a lot more about how to help and protect ourselves as well as our clientele. And kind of moving forward as we, here we are at the end of 2020, going into 2021. Can you touch on, from an employer standpoint, as these things have changed, we've gotten used to this telehealth or telecommuting and not necessarily being on site, but when we are, how we can kind of find that work-life balance that I think a lot of us have learned is extremely important because we've been forced into it. So do you mind touching on the work-life balance part and how that attributes to positive mental health with employees returning back to a safe work environment?
You brought up two very interesting points. The first one is, what's real? One of the issues that we run into is the fact that we are getting conflicting evidence from different sources, starting with the World Health Organization, which has now become quite discredited, going to the CDC, and of course going to the county agencies that regulate what we do. When you look at the CDC website, for the most part, it's a reliable source of information. However, they do have contrarian information as it pertains to, for example, the face masks and, quarantine and all of those things. So again, we still have to maintain trust in the federal agencies because they are working very hard to give us guidelines that make sense. At the very beginning, nobody knew. This was very novel, this was very scary, this was very anomalous. But now we're beginning to understand that a little bit more. We are seeing more cases, but the mortality rates are decreasing. So there's good news in the horizons. There's also the vaccine, and people are happy about that because it gives them another option with regards to safety concerns. Now, what we have seen with regards to telemedicine is that this is a phenomenon that is here to stay. And what I'm running into a lot is that people still have concerns and fears. And sometimes it's a little bit more convenient for a person, whether it be a patient or whether it be a business, anyone, to sit at home and have a conversation via tele whatever. We're seeing that happening with schooling, and of course we see that with patients and with clients. Understanding that people have now become comfortable with tele everything, we have to understand that there have to be basic premises for people to have their own little space at home. People have to have a space free of distractions. You cannot have your child asking you for cookies and milk. You cannot have your dog begging for a treat. And you have to have an environment that is conducive to conducting business. The biggest mistake that I see people making is that they grab their laptop and they figure I can open it on the kitchen table, everything else is going on around me, and I can still do what I normally do. That doesn't work. So we have to understand that there has to be a sense of propriety with regards to your working space. As long as people have their own working space, things work fairly well.
Well, Dr. Alva, thank you for your time. I think some of the key takeaways from today's topic of conversation was for employers to really look at creating a safe work environment for their employees to return to so they can feel safe to provide, in our case, the care they need to the patients and or provide positive business-to-business type interactions. For those that are doing the telecommute or telehealth, it's having that personal space that you touched on in their home environments that are uninterrupted so they can focus on the task at hand. And really, it's as we kind of continue into the new year, it's looking where your sources of information are and doing your best for what you control to control your environment, maintain your safety. So thank you again very much for your time. If anybody has any questions, please feel free to contact us on our phone number.